Welcome to Stress Mess, a stressless podcast where the chaos is real, the caffeine is strong, and swearing sometimes happens, and that's okay. I'm Samantha Elizabeth, health and wellness coach, chronic overthinker, and proud BFFs to stress itself. Here we're ditching perfection, embracing unfiltered real talk, and making mindset shifts that might just keep us from screaming into the void. Let's get messy. What if the thing you think is just stress isn't? In this episode, I'm talking to Dr. Joseph Luftman about the moment his life changed after a near-fatal heart attack, also known as a Widowmaker. As a physician, he thought he understood stress in the body until he became the patient. We talk about burnout, the mind-body connection, and how stress can show up in ways you don't expect. Plus, simple, realistic ways to start taking care of yourself before your body forces you to. Let's get into it. So, hi, Joseph. Welcome to the podcast.
Hello.
Welcome to the Stress Mess podcast.
Yeah, thank you for having me. I really appreciate it.
Yeah, thanks for being on the podcast. Very interesting. You know, I had you had somebody from your PR team or something reach out to me, and of course, I took a look at what you had, and I took a look at what is your topic, and I love this, for my audience too, because I think a lot of people are going to really resonate with this or find it very interesting too. But let's start off with you introducing yourself, and so people can get to know you, and then let's jump into your main topic here.
Appreciate it. Thank you. Yeah, I go by Dr. J. Paul Luftman, at least on the author side, but you can call me Joseph. That's fine. And I been a practicing physician for 25 plus years here in classic westernized medicine world, and was going through the trials and tribulations of that, and experienced a pretty significant near fatal heart attack that threw me for a loop. That's an understatement. It changed my life, and I didn't really feel like I had much creativity prior, but it seemed to open something up in me after to kind of write down my feelings and I don't know, kind of journal a little bit about the experience of going through this and trying to heal through it, and fears and burnout and all kinds of things.
Yeah, I gotta say, as a doctor, though, I'm sure. Oops, sorry, my cat is joining the podcast
Hello.
now.
Welcome.
As people know that have watched this podcast before, my cat and my dog love to be on the podcast, so they will force themselves onto screen. But anyway, what I was saying, what I was asking is, I'm sure as a doctor, it was very different, and it's very different for people that are not in the medical field or don't work in the medical field to see the kind of the behind the scenes things. What was that like as a doctor to go through something so almost catastrophic within your life? And knowing what you know as a doctor, how is that different, do you think, than the advice that you had given patients?
Yeah, I mean, I think, it's very humbling. And to be honest, I think, it's hard to compare. I only know my experience, but obviously I've been with patients. I did hospital-based care and teaching for many years. So I did see a lot of really sick people, and, but, I'm not in their body. I'm not in their experience. I just heard what they would talk about, and I would have conversations, and I tended to do a lot of counseling, even though I'm not a psychiatrist, psychologist. I felt like it was part of kind of what we did, or at least I took it on in that space. So it's a little hard to tell because I don't know their experience, but from what I heard, I think it was very similar, and maybe mine was maybe a little more shocking because I just, part of it was, and I did put this in the book, that, I just, my head was spinning, I really couldn't ground myself in what was happening. And I tried to portray that right off the bat in chapter 1. And I remember when I sat down to write that a few years ago, maybe 2-3 years ago, that aspect of it, I tried to capture the emotion and not necessarily the dialogue or the quotes or
Sure.
anything. And, it was so, it was so surreal. I think that's one of the best words for it. Right. So, for me, it was shocking. And, I remember I was, in a place of they may be, somewhat unique to healthcare providers, but a lot of people may feel it, where I really thought like I was having a panic attack or just really nervous or something, anxiety or whatever. And I was really like embarrassed. I'm like, this is, physician,
like,
shouldn't
do
be
I need to
doing
be
this.
here?
The paramedics are going to laugh at me.
Yeah. That's totally understandable. I have panic attacks, and sometimes I kind of go, okay, is this a heart attack? Because I'm in my 40s now. And so I look at it kind of like, am I having a heart attack or is this a panic attack? And I'm like, I try to figure out like where the sensation is. Where would be the marked difference between somebody actually having a panic attack versus a heart attack?
Yeah, I mean, panic attacks feel awful, and I think that it's probably something where maybe it's probably almost impossible the first time you have one.
Yeah.
I don't know that anyone can talk you through it in a rational way the first time you have a panic attack. And many people, their first panic attack, they do get checked out. And I think that's reasonable. I don't think that's unreasonable. What I think happens is there over time becomes some degree of familiarity with that as it's happening. And that could also be triggers, right? Like that you have looked into the panic a little bit and now know, oh yeah, like I had this family meal and now like it's the next day and it's like I'm still coming down from the stress of dealing with people who don't understand me or whatever. If you're a highly sensitive person, I think a lot of people feel that way with their families or with friends or in other situations, maybe a social situation. And so I think it's not just the symptoms, but it's putting in the context of, what I just went through. And more than anything, I mean, most of them don't last too long, obviously. If the symptoms are persisting, I think you have to get checked out. Obviously, a panic attack can lead to a heart attack if the stress is bad enough. So, I think there has to be some level of like, okay, this is pretty bad. I need to get checked out. If I'm doing the things that I've learned and I'm trying to settle and I'm trying to, do my trauma releasing exercises, whatever, all these things that people learn and these tools that are available now, which are great, are not working, then, I think it behooves you to get checked out for sure. And don't, like you just said, you're a female in your 40s now. I mean, we're seeing females in their 30s have these where like, don't put yourself in a group. Cause that was me laying in the ER going, oh, I must be having a panic attack. I mean, I'm in my mid 40s. I have no cardiac risk factors. Like and then I'm hearing the nurses say like, we got to get ready. We got to give you the blood thinners. We're headed to the cath lab. And then I'm going, oh yeah, no, wait, I'm not having a panic attack. Like it, so that's where my mind was spinning. But I think it's imperative that we don't put anyone into any categories because anything can happen to anybody. It may be rare, but doesn't mean it can't happen, on a one-off situation.
Right. Yeah, I gotta say, I was 19 years old when I had my first visual migraine. And that was a little jarring because I thought, and I had it where I had the sharp pain in my left arm, and my left arm went numb, and it's a migraine. But I was 19 and I went to the emergency because I thought I was having a heart attack at the age of 19. And I went in, but my vision was also messed up too. I had those hallucination type spots, that people have. And, I had lost vision completely in one eye. And I do have, anxiety, panic attacks too. So sometimes I think if I have both of those at the same time, I'm going to definitely think it's a heart attack, because I would have the pain in my left arm and I would have, of course, heart racing, all of that kind of stuff. And I know, I mean, you're on the Stress Mess podcast. I mean, there's a reason why I have the Stress Mess podcast is because everybody knows I have more cortisol in my body than I need. So, that is something. But that's a good distinction, for people to understand their bodies, to be able to understand what does a panic attack feel like and what this feels a little different.
Yeah, I wouldn't want to list like this is one, this is the other, because there really is a lot of overlap. So I think it's context. And I think if it really happens for the first time, you got to get checked out. And I can tell you from the healthcare worker side, what was so hard for me was I did feel shame and embarrassment as I was going through the process, which is ridiculous. And that's how out of my mind I was, because I've been on the other side and I've taken care of nurses and doctors and all kinds of people. And I don't have any judgment about anything. I mean, I think most of us are really understanding of like, the world is a crazy place, especially right now. There's a lot of stress. There's a lot of things going on. And if you end up getting checked out and all you have is some panic and anxiety, and we got to give you a referral to a psychiatrist or something, okay. It's not like we're not making judgments about who you are or what you're going through. Everyone's got their circumstances, So I think that's the other thing for most people to realize is that, I think for the most part, I would say, obviously, there's always exceptions. Most healthcare workers in the United States, at least, are going to be pretty open-minded to these things and non-judgmental.
Yeah, I think that's a good message for a lot of people because I think about it, sometimes like if I were to get into a car accident or, something like where I would need to go to the emergency room or to the hospital, I would be embarrassed, that even though it's like, this is legit, I definitely need to go to the hospital, get checked out, get something, where something's wrong. But it is embarrassing for a lot of people to go to the hospital, and I think that's the reason why some people put it off or, don't wanna go see the doctor to get something
or just
checked out.
scary. There's this whole group of people who are just afraid to hear anything negative about their health. I think there's people who get stuck in obsessive OCD loops. There's people who really, they may be hypochondriacal, but it's just like in their DNA, maybe family history, who once you tell them something that's even remotely like not you're okay, it's going to get really sticky. And I think that they're more afraid, not necessarily that their health is going to be negative, because whatever it is, hopefully they can deal with it. But more that just the stickiness, the way that captures their now future thought processes, that when anything happens, now I'm worried about this, or I'm thinking about it all night long, or, people that have anxiety, I think are much more worried in many cases about thinking about what's going on with that test. There are people that are afraid to do mammograms because it's like, well, 1 out of 10, they're going to find a cancer, but 9 out of 10 times if they find some slight abnormality, I got to go through this, and this to make sure it's okay. That's a lot of false positives that really does have an impact on people, right? It can have a real psychological impact on people. So those things are not trivial. And I think Western United States practitioners know that, and they understand it, but it doesn't, necessarily make it easier for people that are struggling with, do I go or do I not go? I don't want to be told bad news,
Yep. Yeah, definitely. There's so much I want to talk to you about. I want to talk to you about what led up to the episode because, we talked about, before about burnout and, things that were happening in your life at that time. So let's talk about that. Let's talk about the episode. Let's talk about your book too, because I really want to dive into that. And I know you've alluded to that already, but let's talk about what led up to your incident, and then we'll talk about the book, of course.
So I think what was so jarring about mine was that I had done about a 15-foot elevation hike like 2 days prior with no symptoms, gone to a concert later that night, jumped around. It was standing room only, and I was jumping around and dancing. I love music, and I felt fine, and then this came on, and it felt like heartburn for me, which I've had a lot in my life, and it just didn't get better with the usual treatment, and then it kept getting worse and worse. So in terms of the acute aspect of it, like within a few days, there was no warning signs. Yeah. The warning signs were long-term, and I only see that in hindsight now that, the burnout was there, the stress, family situations, all kinds of stuff going on with work, that really had accumulated. And it was even more insightful when I started writing the book that I realized that some of the healing things that I started finding, they actually happened before I got sick. And now I look at them as very serendipitous. Like they seem to just come into my life at the right time in the right place, when prior to that, I hadn't had any. I'm talking about like sort of meditation and yoga and things like that I hadn't really been exposed to. And then all of a sudden I was, and I'm convinced now, and I put it in the book, that those things came into my life at that time to kind of help me survive this and recover from it in a significant way. So that was very powerful, and I talk more about that in the book. But but I think what I landed on was that, for me, after going on this large search for like, how could this happen to me without cardiac risk factors and stuff, is that the chronic stress, a lot of it from childhood trauma that I started to really come to grips with, and other things that happened to me, were taking its toll on my physiology. It's that the mind-body interaction for me was exemplified. And I kind of knew it, and I kind of almost had a premonition that I was going to get sick a few years prior. I didn't, but it eventually happened. And that was, again, looking back and kind of writing things down, especially during lockdown, when I had all this time and I started really writing, it really, like, it sort of, that's when I kind of put it all together. It took some time in the healing to understand the level at which my system was stressed. And by the way, all that time when I went through all this stuff, I had some complications after the stent was placed and other things. Just everyone was like, "What is going on with you?" Even my colleagues and friends who I know and I'm going to see, like, I'm getting multiple opinions, and no one's really has a good answer for what just happened. And what I pieced together and I put in the book is that, the childhood stress onward, starting really young age and moving onward, that just became perpetual, took its toll. And the only thing that was really abnormal in my case was inflammation that was probably driven by the stress. And that was the only thing that was really abnormal shortly after we found it when I presented, or was recovering shortly after. So I kind of put all that together in the book. It's called, just again, we probably should have said it early on, but it's called The Widowmaker's Gift. And I see it as, sort of half memoir of like this experience, and then half, pieces of wellness, pieces of education to, it's geared towards healthcare workers, but I think there's a lot of really salient points for all kinds of people. I just had to kind of pick an audience, and it made sense for them because, my colleagues I know need to hear it. But, I hope to expand. And by the way, my business, where everything is kind of kept now, is under the saturationofsound.com moniker. That's my website. And I use that as a proxy because in the process of going through this, it came to me in a sound bath I was in. Like this, I had this kind of crazy mystical experience, and that name just popped in my head. And I was like, why is this even presenting? And then I realized afterwards, it's a really nice double meaning, because I think right now in this world, we are saturated. If you use sound as a proxy for the inundation of information, sound, constant talking, videos coming at us, right? Just all of us nonstop with the phones and everything else. But saturating in sound, like I was doing in that sound bath, was also incredibly healing. Right. So it was just, it like fit for me. So anyways, everything's on my website there. My past podcasts and everything, people can go there to reference or buy the book. So.
Perfect. Yeah. And definitely I'll put that in the show notes. I wanted to go back to something that you said. You talked about manifestation, basically. You said that, a couple of years before you thought you were going to get sick, and it almost is like you manifested this, into your life. And I know I've had other guests, talk about manifestation, but when you think something's going to happen, it's probably going to happen.
Yeah.
And so that's the reason why it's great to manifest more positive things, in your life. Like, I'm going to be a millionaire, a secret millionaire, but like, I'm going to be whatever people want in their life, and people do manifest very positive things in their life. And so that's, something that I'd love for you to talk a little bit more about, because I think this does lead into sound, because what you were describing before, what you were doing before was more Western medicine, but sound, of course, is more of the Eastern type of medicine that we have for ourselves. So let's talk about that.
Yeah. Well, all right. Yeah, I'll talk about the manifesting. Let me just say something about sound. I think there's a lot to talk about there, and I did put things in the book, but I'm still, so part of me has not moved on from Western medicine. I still believe very much in the tenets of what we do. Our own system itself is broken in many ways, but I think the tenets of, sort of like double-blind, placebo-controlled trials to really see if an intervention helps, and the way I think that we've managed to improve a lot of wellness care and preventive care, there's a long way to go, but I think the providers are trying to do the right thing. And I will tell you that on the back of that, I believe in looking at evidence. I don't think that we can just take, for example, the study that I put in my book about, certain frequencies killing cancer cells in a petri dish, which is where some of this came from, and extend that into it's going to help everybody, with cancer. We got to look at it. We got to look at who's amenable to this, whom might it make worse. I hope not, but you got to check, right? Make sure it's not harming anybody. You got to see what's the frequency, right? We know on radiation treatment exactly like the dosing and how many treatments it takes and this and that to sort of find that balance between harm and benefit. Same thing with music, like how many doses do we need? What frequency is going to be best depending on someone's personality traits or what they've been through, if they've had trauma or not trauma. So I'm very optimistic about it, and part of why I'm talking about it is to try to increase the familiarity that people have and try to see if it takes off in some way, right? Because we need more work on it. That's what I would say on sound.
Yeah, I gotta. Oh, go ahead, please.
Oh, let me just speak quickly on manifesting, because you did ask about that. I'm not sure about manifesting. There's a part of it that is not as much grounded in science, and so I've had a harder time sort of really digging my teeth into it. And yet, I think there's a lot of really good writings, a lot of good philosophers who have talked about that our mindset really matters, right? I mean, look at someone like Joe Dispenza, right, or these other guys who are out there speaking to the masses. I think there's something to be said for, creating our reality. In many ways, quantum physics tells us about how we create our reality at the most fundamental levels. And then obviously we were bringing it up to our physical selves. But there's something about consciousness. And I put some stuff in the book about consciousness and research, what it is to be us, that seems to tie in with these positive beliefs. And so on manifesting, I'm just going to go right back to where I lived, which is in clinical medicine. The placebo effect is a thing, right? Yeah. It is a thing. It has been well documented now. No one really argues about it. And every study tries to have a placebo group in there, because we now know that if you take 5,000 people and you give half some experimental drug and half a water pill, that like 30% of the people in the water pill group across the board in almost every study get better. So there's something about belief, right? There's something about the nature of healing in that sense. So when I think about manifesting, I think about that because it grounds me in the science that I'm used to. And there is some evidence showing that belief seems to really make a difference. There's more studies than that, but that's the one that I think is most prominent, is the placebo effect, right? And so when I think back to my own manifesting, it's very possible in a negative manifesting way that the worry and the concern that I was having just repeatedly eventually, led to a negative outcome as opposed to a positive one. And now trying to flip the story, I spend every day trying to get out of the negative loops of our world, of news, of the fighting and the polarization in our own societies, all these things that are happening, by staying positive. Because number one, I can't do a lot about it, but number two, I don't want to live in that negative space all the time. I'm going to try to manifest for my children and myself a better life, a better world. I don't know what's going to happen, and it's not. And I think it's not as simple as I'm going to manifest a Ferrari in my thing. Like, people want to just break it down to these very simple things. But there's something about the process that we as humans don't understand that seems to add up to maybe some better things on the whole, if we can stick with it.
Absolutely.
That's what I would say.
I gotta say, I mean, I work with a lot of people on weight loss, and that is something that, it's funny because I'll look at them and I'm thinking that, why are you looking at yourself, in the mirror in a certain lens, and this is one thing, is just that they expect, and some people truly have body dysmorphia, but they look at themselves, as, that I'm fat. And I actually just rewatched this movie the other day, I Feel Pretty, with Amy Schumer, and the comedian, funny movie, just a short premise, of it. But she hits her head in a cycling class, and she's not known as a comedian, actress, and everything for being the skinniest. She often quite makes fun of herself quite a bit for being a little bit more overweight. But in the movie, when she hits her head, and this is something that she had always dreamed about, is being thin, being like, I can't remember who's the actress that was in the movie, but anyway, she all of a sudden like wakes up from hitting her head, and she looks down at her body, which she doesn't have a bad body, like she's not huge, or how she felt in the movie. And then all of a sudden she was like, oh my gosh, I'm so thin and I'm beautiful. And it's like, yes, she is. And it's funny because that's also, what people perceive, as themselves and the things that they tell them, because that goes back to sound. Once again, the thoughts even in your head is what resonates throughout your body. And when you look at a situation and you look at it negatively, even though it might be completely neutral, that's the kind of things that resonate. But then there's also those external sounds of what people tell us and the things that we hear, and maybe even the saturation, of sound, as you say,
Yeah.
that kind of just hits us in a certain way. And it's how we process that particular sound that makes us feel a certain way, and it might uplift us, and hopefully it does.
Yeah. Yeah, I have a lot to say here. I'm going to try to keep it brief. Let me say something about mindfulness. So I did put some stuff in the book about, and I'm again keeping it very brief, right? But I put in some of the things I found, and one of the things that I found was beneficial, that by the way has really gotten colloquialized in our culture now and just like watered down, is this meditation thing, right? It's used so as a just a pop culture term now, whereas the benefit of it and the power of it seems to have gotten lost in that. So I used like contemplative silence and other things in my book to try to sort of move away from this just using the generic term meditation. But there's something about mindfulness, right? There's something about Eckhart Tolle talks about, and others of like that when you sit and even in brief periods of time, which is what I talk about, these micro practices, but even longer sits, that when you learn to sort of watch your inner voice, that you start to realize over time, not right away, initially right away, you tend to be more anxious because it's like you're hearing this thing. And then over time, many people can kind of separate into this space where their consciousness is sort of watching, almost like those bubbles in the cartoon, like, oh yeah, like I'm not my thoughts. Like, so when that thought comes in your head, I don't like how I look, this recurrent thing that could be set up for years. Let's say if you have body dysmorphia or other things, very negative internal script that you would even never say to your friend, but like you'll say it to yourself, that you can stop for a minute over time and realize, yeah, I'm not like, that's not me. Like, that's not my conscious. That's not really who I am. It's just the voice doing its thing. And you sort of like create this space from it where you're just watching it, and then it dissipates over time. Every time it comes up, you can sort of be in that moment and go like, oh yeah, I know what you're doing again. Okay, I see you. And that over time, again, not right away, but over time, that can reduce the amount of anxiety coming from these inner critics, if you want to call them that, right? That are constantly talking about that kind of stuff.
Yeah, absolutely. That's what I tell my coaching clients. I say, whose voice is that, that's telling you those things? Because it might be your overly critical mother, that's kind of implanted those thoughts, into your brain. It might be, your
Sounds like you,
significant
right?
other, right?
Yeah, I mean, it may sound like yours, but you have to really do the investigation. Maybe it is your mother's. Maybe it is a teacher that told you this thing, or you had a best friend who was kind of bullying you, and like it just got stuck in your psyche in this crazy way, and it's not really who you are. But you can't really do it until you slow down and you look at it. And in our world right now, it's hard. It's hard for people to slow down and have a moment of contemplative silence, because it's just we're constantly wanting to have the stimulation. So I think it takes that, but I think it can be small amounts. I talk about in the book micro practices. I talk about for healthcare workers, like you can have a moment when you're washing your hands, where you're literally just offloading for 10 seconds. Like, what is my mind? Like concentrate on the washing the hands or my breath, and I'm going to let go what I just dealt with in the room or what the nurse is telling me, whatever, and just kind of be here for 4 breaths. And when added up over time, along with maybe turning the radio off in the car and not talking to anybody, and just kind of being, sort of with your sort of watching those thoughts as they stream through your head about all the things you have to do, you start to create that space that I think could be really powerful.
Yeah, absolutely. I think a lot of people feel like they have to take significant time, to be able to do that. And I love that way you said that the micro healing, those micro moments that you can take within your day, where you are washing your hands or maybe even driving too. You don't have to have the radio or an audiobook going. where you can actually just sit there and examine your thoughts, and hopefully you don't spiral into a negative space, which is
Yeah.
a lot of people do when they start to think about the negative, and then they think about what's the next negative thing, and then all of a
Yeah.
sudden they've gone down this negative road. um, they could do the same with positive. It's a little harder as humans, as
Yeah.
we know,
Yeah.
to go
Yeah.
more to the positive because we tend to focus on the negative more. But yeah, I think that, that's good. I like that lesson, quite a bit.
And
Micro healing.
yes. And by the way, there's literature showing, again, just in the last 3 years, that the micro practices seem to be making a difference physiologically. So it's not
Hmm.
just like, because it's always good to put some science behind it. Like
Hmm.
you can believe me, but you can believe a million people who are pretend to be gurus. But if you put the science behind it, that seems to show that doing less than 5 minutes once a day is better than nothing,
Yeah.
in terms of blood pressure reduction, improvement in inflammatory markers, brain changes on fMRI. Now all of a sudden it becomes a little bit more grounded in something where you can really kind of believe in it and say like, oh, okay, there's some real good data to show that this seems to be making a difference in terms of well-being.
Yeah.
So I think that's powerful. I was watching, and let me add this, because I really feel strongly, and I put it in the book, but I feel strongly about being as transparent as humanly possible, which is that it can be jarring when you first do this, right? And it's now really, I was watching a podcast the other day of they were talking to one of the guys who's really done some of the seminal research on meditation. He's from Wisconsin, blanking his name right now, but he's done great work on this. And he showed very consistently in the first 7 to 10 days of anybody in these programs, there's a consistently higher rate of anxiety that most people who start feel something a little uncomfortable, because it's
Yeah.
really can be jarring to like first start hearing where you've distracted for so much. Now you have no distractions and that voice is going. It can be really, really disorienting. So
Yeah.
that is the thing. And for me, I talk about the story in the book of when before I got sick, finding meditation, and I was just doing it to see if I wanted to offer to my patients because I saw some of the research coming out of Harvard. This is like 2011, 2010. So I
Hmm.
went to a course to see if I'm like, well, I should probably experience it to see if I should offer it to patients who are struggling. And I was a mess, right? I was 10 minutes in. I'm like, I got to get out of here. Like I'm on the verge of panic. Like I can't do this. And as
Yeah.
opposed to a lot of people, anyway, I talked to my family and other friends who were like, yeah, I tried meditation. I couldn't do it. I didn't say that. I said, wait, this can't, like, there's got to be something wrong if I can't sit here for 10 or 15 minutes with my thoughts. Like that's kind of nuts. So I did the opposite. I was like, I want to do more. I want to find out what's happening. And I did see the benefit. But again, those first few days can be a little jarring. And I think people need to know that. Like it can be a little disorienting at the beginning. But if you stick with it, most people seem to really find benefit over the longer haul. But I don't think it needs to be an extensive amount of time.
Yeah, absolutely. I gotta say, when I first started meditating, now I do those shorter meditations, but yeah, I started off with, okay, I got to do 10 minutes of meditating, which means that I got to sit, down, and I've got to put my legs in a certain way, and I got
Yeah.
to sit there. And, I know that there's a lot of direction on meditation that don't think about anything. Like if you see a thought, let it pass by. And I'm like, no, I can't do that.
Yeah.
But, what I can do is, and I also felt like 10 minutes out of my day was unproductive, but then I'll do other things that are so not productive, you
Completely
know,
unproductive. Yeah.
and not
Yeah.
even think about it. Right.
Yeah.
But, it's that sort of thing where I was taking time for myself, which is like, people that know me, I am a helper. I am, somebody that gives to other people that not necessarily gives to myself. I am learning,
Yeah.
but
Yes.
that is something that I do see with a lot of people, is that they don't want to take that time. But you're absolutely right. Those micro practices, those things, of time of healing that you can do during things that you're already doing, just switch off your brain for a little bit, or, rather just maybe not think about anything in particular, just see where your mind goes, and hopefully
Yeah.
not to a negative space.
Yeah. And realize it might, and many people's, they can't control it, and it may go to a negative space. It may be self-critical. It could be other anxiety provoking things, but they're almost all impermanent. And that's a
Right.
huge part of the Eastern teaching that kind of got lost in the mix of sort of making this secular mindfulness practice applicable to Western minds was, impermanence is a big part of this. Is like, if you watch your thoughts enough, if you really are doing this work, you realize over time, like, it doesn't stick. Like, it'll come and go, but like nothing really persists like that. It often just, like, you sit there and watch it, and then you watch as it kind of fades into the next thing about how you got to buy milk or eggs, or you got to help this other person. And it's like, that's just how the mind does its thing,
Mm-hmm.
So yeah, I'm a believer in the micro practices adding up over time. And I feel like in many ways, some of the teaching that I looked at as I was going through my own healing was really not going to be applicable to people in our culture, because they're not going to do it. They're just not going to take the amount of time that's being asked of. They're not going to do homework. They're not going to, I see all these things on journaling and stuff. It's great. If you can do it, fantastic. But most people just are not. They're busy with their kids and work and money and spouse and, Little League games and gymnastics. And, like the general person is like, how do I get better and have more wellness and have better quality of life in the midst of, I still want to have the vast majority of my life, which is why I built these principles.
Yeah, you're absolutely right. And thank you so much for bringing all your wisdom, not only your learned wisdom, but what you learned about yourself and learned about the world too. Um, I would love for people to be able to find you, to be able to learn more about you, read your book. I mean, like, I gotta say, I mean, this is something that I found as unproductive time, was actually sitting down and reading a book. I used to do that, but now it's like, oh, this feels unproductive.
Yeah.
I started adding it back into my practice, and all of a sudden I realized I forgot how much I love to read. And so I'm very, very much looking forward to reading your book, because of everything that you said here.
Right.
But then also, it just sounds absolutely amazing, where you go, and you explore the Eastern side of medicine. Obviously, you have a great understanding of the Western side of medicine too. But I think that for a lot of people, especially in the US, that we're so strong in Western medicine, that people
Yeah.
can learn from both and, be able to apply it to their lives. So, where can people find you on the web?
Yeah, I think, my website, I think, is, probably the place to start. I definitely communicate directly with me through that. I have a contact page, saturationofsound.com. I've got the past podcast listed there, and hopefully I'll add this one onto the media tab. But there's, I think, really a lot of valuable information there too. I put a couple other videos on some practices in the workplace, and it links to all of my social media stuff. I'm on Saturation of Sound too on Instagram and LinkedIn and other places for professionals and others. And I'm just trying to create small amounts of content here and there to get the word out. I understand some people don't have the ability. Oh, by the way, I did do an audiobook, so for those of you who would rather just listen here and there, that's fine. And if you want to put it on 1.5 speed, I won't be offended, to try to get through it a little bit more quickly. But, I narrated it myself, and I think it was an incredible experience for me to take everything I had learned in the book and written the book and written in the book and sort of applied to this, and then, took the words from the page and tried to make it meaningful with how I was sort of getting it across in words, and so, I encourage people, if that's easier for you, grab the audiobook, that's fine.
Oh, wonderful. Well, thank you so much. And thanks for giving us so many options, to be able to, I guess, learn from the book. So thank you so much. I will definitely put all of this in the show notes so everybody can check you out. And thank you so much for being on the podcast.
Appreciate it. Thank you for having me. And I look forward to, hopefully, expanding our conversation in the near future too, if we can, about some other things. I know just in watching what you've put together, there's some really, there's so many avenues we can go in this space, but it's been great. And I think the work you're doing is awesome. So keep up the good work. I appreciate it.
Great. Likewise. Thank you so much.
Thank you. Take care.